Hello. So, in the previous videos, we learned the basic anatomy and terminology for understanding the neurohormonal pathways. In this video, we will use that information and learn the pathways. So, what happens when you are hungry? Ghrelin comes from the stomach to the arcuate nucleus in the brain and activates the weight gain pathway. It activates the first order neurons, NPY agouti related peptide, which then activates the second order neuron system, which in turn drives the orexigenic pathway. Then there is the weight loss pathway. Leptin, insulin, and several other hormones come from the periphery again to the arcuate nucleus and activate the first order neuron, which is the POMC card neuron. As we talked about before, we have the release of alpha MSH to the second order neuron, leading to activation of the anorexigenic pathway. So, if only one pathway can be active at one time, then how do these pathways talk with each other? Activation of the NPY agouti related peptide deactivates the POMC card neuron. Agouti related peptide deactivates the MC3, MC4 receptors on the other side. On the other side, leptin and several other hormones, they deactivate NPY agouti related peptide. So that's a quick summary of neurohormonal pathways, and the boards love to test this. There is another concept that gets tested a lot. As the adipose tissues overall decrease with weight loss, so does leptin levels. And as leptin drops, ghrelin activity becomes more prominent, leading to more hunger with the weight drop. This is something I inform my patients about when they choose to only make lifestyle changes and not use anti obesity medications. Let's do few quick sample questions. Which of the following best describes the changes in the neurotransmitters in response to fasting state? A change in ghrelin level increases activity of POMC neuronal circuit. The change in insulin level decreases the activity of agouti related peptide neuronal circuit. The leptin level change decreases the activity of agouti related neural circuit. The change in POMC neuronal circuit activity decreases stimulation of the melanocortin receptors. So, choice A, yes, ghrelin levels are increased in fasting state, but it increases NPY agouti related peptide activity, not POMC. Choice B, agouti related peptide activity is increased in fasting state, not decreased, so that would be incorrect. Choice C, for the same reason, would be incorrect. Choice D, the change in POMC neuronal circuit activity decreases stimulation of the melanocortin receptors. So, yes, this is the other side of the pathway, which is the satiety pathway that would shut off because the hunger pathway is working. So, the answer would be D. And you can see that in this illustration that we talked about before. So, another question. A 32-year-old patient with BMI of 38 is placed on a low-calorie diet and successfully loses 12% of her body weight over 5 months. However, she is experiencing an increase in hunger that is making it hard for her to continue to adhere to the dietary regimen. What are the underlying biological mechanisms that explain her increased hunger? Increased GLP-1 and ghrelin levels leading to increased POMC release in the hypothalamus, decreased GLP-1 and leptin levels leading to reduced POMC release in the hypothalamus, decreased PYY and ghrelin levels leading to increased NPY release in the hypothalamus, increased ghrelin and leptin levels leading to increased NPY release in the hypothalamus. For choice A, with weight loss, the ghrelin levels will increase, and but that means that the NPY side will activate, and it will stop the other side, which will decrease the POMC release. So that option is incorrect. Decrease in leptin leading to decrease in POMC release, that's possible, so that can be an answer, but let's see the other choices. Choice C, decrease in ghrelin causing increase in NPY, that does not fit, so that's incorrect. Increase in ghrelin and leptin leading to increase in NPY release. With the weight loss, leptin would drop, not increase. So that makes the option incorrect as well and leaves us with choice B as the correct answer. I hope that was helpful. If you have any questions or feedback, please leave a comment. Thank you.